of UNICEF and WHO Global Strategy on Infant Feeding. The aims of this theme are to 1. Take stock of lessons learned and achievements over the past 20 years on infant and young child feeding, commonly known as IYCF. Secondly, to assess the status of implementation on the global strategy for infant and young child feeding global strategy globally. Thirdly, to celebrate successes and achievements nationally, regionally, and globally to showcase national work at a global level. Also, to call for action to bridge the remaining gaps in policy and programs on breastfeeding and IYCF, and also, finally, to draw public attention to the state of policy and programs on breastfeeding and IYCF. Fellow Gambians, the theme of this year's celebration seeks to underscore the importance of policies, programs, and strategies for effective implementation of optimal infant and young child feeding. It seeks for collaboration among various partners in reassessing, analyzing, and taking appropriate actions to protect, promote, and support breastfeeding nationally, regionally, and globally. Going back to the 1970s, when the breastfeeding movement took center stage by exposing the devastating effects of bottle feeding, the international debate led to the WHA, which is the World Health Assembly, in adopting the International Code of Marketing of breast milk. Now, the International Code of Marketing of Breast Milk Substitutes, known as the Code, was incepted in 1981. In 1990, the WHO and UNICEF led efforts to adopt the Innocenti Declaration on Infant and Young Child Feeding, that operationally targets to ensure that every facility providing maternity services fully practices all the 10 steps of successful breastfeeding, giving effect to the principles and the aim of the code, and enact legislations protecting the breastfeeding rights of working women. Fellow Gambians, the 10 steps that lead to baby-friendly hospital initiative, commonly known as the BFHI, was launched in 1992 to protect, to promote, and support breastfeeding, especially exclusive breastfeeding, in all healthcare services and facilities. This is to provide maternal services, and over the past 10 years, many hospitals have worked very hard to become baby-friendly, and many health workers have been trained on breastfeeding counseling to help mothers to breastfeed optimally, both in the hospitals and in the community. In 2002, to enhance progress, WHO and UNICEF also developed and launched the Global Strategy for Infant and Young Child Feeding, which sets out 5 additional targets. The first one is to develop and implement a comprehensive policy on infant and young child feeding. Secondly, to ensure that health and other relevant sectors protect, promote, and support exclusive breastfeeding for a minimum of 6 months, and continue breastfeeding up to 2 years or age beyond. Thirdly, to promote timely, adequate, safe, and appropriate complementary feeding with continued breastfeeding. Also, to provide guidance on feeding infants and young children in exceptionally difficult circumstances, such as the cases of malnutrition, low birth weight, emergencies, and HIV infection. Lastly, to consider what new legislation may be required to give effect to the code. In addition to the global strategy described in detail, the actions required to implement these targets through policies and programs in health facilities and in the communities. In the Gambia, all the facilities implementing the BFHI has developed their own specific breastfeeding policies. The health workers and the healthcare system as the mother's first point of contact, and as a result have been empowered on training on lactation, management, and breastfeeding counseling, and do not only possess updated knowledge, but also provide guidelines and other relevant materials on how to initiate, promote, and sustain breastfeeding. However, the health workers and the healthcare system need to be cordial, kind, and willing to support and empower every mother to clearly communicate and demonstrate the necessary steps and skills outlined before and the knowledge of breastfeeding. Regarding the Baby Friendly Community Initiative, BFCI, a comprehensive nutrition and health education package that encompasses maternal nutrition, infant and young child nutrition, environment sanitation, and personal hygiene and growth monitoring. Much success has been realized in its implementation. As of now, 691 communities across the country are implementing the BFCI. In the developing world, progress in exclusive breastfeeding has been modest, improving from 32% around 1995 to 39% around 2010. A relative increase of about 17% actually has been realized. In the Gambia, some progress has been made in improving exclusive breastfeeding rates. According to the Multiple Indicator Cluster Survey, which is now commonly known as the MICS mix, the rate of exclusive breastfeeding has reached 41% in 2006, but then again, it has dropped by 33% in 2010. This is the real cause for the concern that has required sustained efforts and resources from all partners at every level. Fellow Gambians, the global scientific community acknowledges the vital role of breastfeeding for infant survival, growth, and development of the 136.7 million babies born worldwide every year. Over the past 20 years, it has been documented and scientifically proven by experts that breast milk alone can provide all that the baby normally needs for the next 6 months of its life. No extra drinks or feeds are needed during this period. It is also proven that mother's breast milk fosters optimal growth and development for the baby's brain, immune system, and general psychology that is vital factor in preventing common illnesses, especially diarrhea and infections of the respiratory and urinary tracts. Research has shown the best feeding option globally is initiation of breastfeeding within the first hour of life. Research has shown that best feeding option globally is initiation of breastfeeding within the first hour of life. Exclusive breastfeeding for the full 6 months, safe, age-appropriate, nutritious, and adequate complementary foods after 6 months, and continued breastfeeding throughout the second year and beyond. Today we can celebrate some definite improvement, but still less than 40% of babies benefit from exclusive breastfeeding for a minimum of 6 months. The modest increase in overall global rates of exclusive breastfeeding realized since 1990 in some countries have been achieved by a combination of actions guided by the global strategy. These actions have included national legislation of the code and the maternal protection of working women, ensuring that breastfeeding is initiated in every maternity facility, and also in building health worker capacity and offering counseling. In the past 10 years, the government of the Gambia, under the visionary leadership of His Excellency Sheikh Professor Alhaji Dr. Yahya Jammeh, has demonstrated continued commitment in putting in place the necessary legal and policy frameworks to protect, promote, and support breastfeeding. These include the National Nutrition Policy from 2010 to 2020, the National Health Policy of 2012, the Breastfeeding Promotion Regulation of 2006, the Women's Act of 2010, to just name a few, and also the past National Health Policy of 2010. The promotion of breastfeeding is part of our culture and tradition, is amply demonstrated in the Gambia's other development blueprint documents, such as the Vision 2020 and the Program for Accelerated Growth and Employment, commonly known as the PAGE. The government has put in place plans to upscale proven cost-effective community-based nutrition interventions at all communities, including the BFCI, the Integrated Anemia Control Program, vitamin A supplementation and deworming, salt iodization, and nutrition education of behavioral change. The revised National Nutrition Policy of 2010 to 2020, with all its accompanying strategic plan and other relevant national policies and strategies, are all plans in supporting national actions and in upscaling and providing focus and direction for the implementation of appropriate strategies to protect, promote, and support breastfeeding. Fellow Gambians, it is therefore important